Hello everyone, I am Dr. Sharifah and I am a consultant gynecologist at the Hospital Picaso.
Hi everyone, I'm Dr. Tani Ping, consultant gynecologist at Hospital Picaso.
Okay, today we are going to talk about endometriosis. Endometriosis is a disease that affecting 1 in 10 young women or women in the reproductive age group. It means these women, they are in their prime age of their lifetime. Here we have many questions compiled about endometriosis, and let's get into it.
Endometriosis is whereby the endometrial lining grows in other organs. Why is it difficult to diagnose? Number one, everybody regards menstrual pain as normal. And that is a problem. So a lot of women actually suffer menstrual pain for years and years, all because they think it's normal. Most women, by the time they knew that they have endometriosis, is usually 7 to 10 years later from the beginning of the disease. There's always delay in diagnosis. The second problem is initial stages of endometriosis cannot be seen by the usual ultrasound scan. So if they just go and see any doctor and just scan, everything is normal. But actually, endometriosis is already there. That's why if you just simply Google what is the diagnostic test for endometriosis, it's always laparoscopy. But laparoscopy is a surgery. How are we going to make all these women go for a surgery just to confirm the endometriosis? And therefore, there is a lot of delay in diagnosis.
Yes, another thing is that endometriosis, many of them also have coexisting bowel symptom, urinary symptom, like constipation, sometimes diarrhea. So most of the time when they visit their doctors, the period pain symptom was not being looked into, and they get a different diagnosis like irritable bowel syndrome or irritable cystitis, things like this. So that's why it takes many years, the symptom of a period pain being taken seriously. So I think for endometriosis, surgical management of endometriosis are very challenging as compared to medical management. Yes, Dr. Tan?
Yep.
Medical management, we can just give medicine and then see how patient, how's their outcome like, But then surgical management are another ball game altogether. This is because number one, we need to have advanced minimally invasive skill in laparoscopy, and of course better with robotic surgery as well. Because nowadays robotic surgery has been shown to be
cannot be open surgery.
Yes, I think the most important thing here is that it shouldn't be an open surgery. Open surgery for endometriosis is obsolete. In fact, it might cause more harm for a patient with endometriosis. Okay, that's one. Number two is that access to the facility that can provide a good laparoscopic surgery to be done, or robotic surgery. Not all hospital has high-end facility as well.
Yes, and also not just one person, not just the gynecologist, but the entire team must be good with advanced minimally invasive surgery. The urologist, the colorectal surgeon, the hepatobiliary, the upper GI, because we never know what we need to do in a patient. Every patient is different, and endometriosis can grow anywhere.
Yeah, another thing is that the disease most of the time is not simple, straightforward. When they need surgery, usually the disease are severe disease and involving multiple organs. And because of the nature of the disease, a chronic inflammatory, most of the time, endometriosis, the organ adhere to each other. And the pelvis, sometimes we call it frozen pelvis because of multiple adhesions. So the operation is going to be very complex because we have to separate the organ, and the disease is somewhere in between the adhesions. So the principle of the treatment or surgical treatment of endometriosis is that we have to eradicate the disease, we have to clear the disease, but we have to minimize the injury to the organ.